As part of the Children's Hospital, we also have the Children's Pediatric Emergency Room. We felt it was very important to get this separate area established early because we want children to be taken care of in an area where they aren't mixed with some of the other patients who may come in for care. So they don't have to be next to an adult who may be having chest pain or may be inebriated or whatever else. But they can be in an area of their own, taken care of by pediatrically trained nurses who are able to deal with their behavior and also with the pediatric illnesses. So we've had a pediatric emergency room here since 2000. We think that this has really resulted in increased level of care that we are offering for these children, and we see more satisfaction with the families. So in our pediatric emergency room, again, we deal not only with the child, but of course we have the family there and we interact with the families at all times in trying to figure out what's wrong with their child. Does their child need additional care? Can we take care of them with an emergency visit alone, or would they be better served by either being admitted to the hospital for additional care or going back to their own pediatrician? We always support the medical home and the idea of each child having their own pediatrician because we think this is really important. Even the child with chronic illness needs that pediatrician to kind of manage things, to make sure that nothing falls through the cracks, that they get their vaccines, that they get all of the appropriate developmental care that they need that can best be done by a general pediatrician. So our emergency room people communicate to all of the doctors who are the primary caregivers for these children. And we find that that makes for a much better episode of care because although the parents know the children best, there's no question that the regular pediatrician knows more about the child than the emergency medicine physician. So in this way, we ensure that all the information is available and that we don't miss things that we don't have to repeat things that have already been done, and we know that there are things that we think maybe should be done. So in this way, again, we get the family involved, but also the medical home involved to ensure the best care for our patients.